Fortunately, there are a lot of things on the horizon, so I'm going to focus on just three. There are new compounds in the works. One of them is belzutifan, and this arose out of Nobel Prize winning research, on the oxygen sensing mechanism of the body. That drug that was kind of the initial test case, if you will, was belzutifan or Welireg. That's been approved in advanced disease. And we've just heard that some trials were positive earlier on, both in metastatic disease and in the adjuvant setting, so after treatment for localized kidney cancer. So those types of drugs, HIF-2 alpha inhibitors like belzutifan and there are others, are being moved up in the paradigm and importantly combined with other therapies, potentially to greater benefit for patients. So that's one thing, HIF-2 alpha therapies. The second thing is biomarkers. And so this has been a holy grail for kidney cancer. Every meeting that I go to for the last 10 to 15 years, it's been, where are we with biomarkers? But now we actually have some good biomarkers. And so just to name a few, one is KIM1, so kidney injury molecule 1, and there's a doctor named Vincent Zhu at Dana-Farber that's pioneering this, but we may be able to tell who's going to benefit from our therapies in advanced disease and possibly even earlier in localized disease, and tailor our treatments, based on blood levels of this molecule. There are other a little bit more elaborate things like looking at different phenotypes or different types within clear cell kidney cancer. That's very complex, so I won't touch on that, but just to say that it's exciting and there are some trials that have shown that's a promising approach. We're trying to develop deep durable responses for patients with metastatic disease, so cancer that's spread outside the kidney. And that's exciting because when you can get a deep durable response, and what that means is really you get a very large amount of tumor shrinkage, sometimes where there's no tumor left even visible. When you get that deep response and it lasts, meaning it's durable, that is a pathway to remission, and then that is a pathway to cure. And so what we're doing to try to get there to these deep durable responses is we're combining multiple agents that we know are active, sometimes newer agents as well, and especially immunotherapies, because we know that when I ask them what they mean by cure, they usually say something like, there's no cancer and critically, I'm off therapy. And so the reason immunotherapy is important is if we can help the immune system to recognize the cancer, sometimes the immune system can recognize the cancer even without any treatment anymore and can do that for the rest of the patient's life. And so that's how we get to cure. And so that's really the third thing that I think is exciting, that we're in a position where we have such active existing regimens that we can try to build on those to even get better responses that are longer lasting to get down that path to remission and cure.